Cuba. Most people picture classic cars, cigars, and communism. But there's another side: medicine. Despite decades of economic embargo, Cuba has become a global leader in healthcare. You'd expect disaster, but Cuba boasts more doctors per capita than most developed nations and a lower infant mortality rate than the US. This isn't propaganda, it's a fact that's baffled experts for years. Cuban doctors serve worldwide, from Ebola in Africa to earthquakes in Haiti. How did a small, isolated island achieve this? It's not about one leader or a single promise, but a decades-long journey of innovation and hardship. Cuba's healthcare paradox is one of the most fascinating stories in modern history. Let's find out how they did it. So, how did Cuba build a world-class healthcare system against all odds? Understanding Cuba's journey matters, especially as healthcare costs soar globally. Before the revolution, healthcare in Cuba was a privilege for the wealthy, not a right. Most rural Cubans rarely saw a doctor. The system was broken and deeply unequal. The revolution made health a top priority, a right for all, not just the rich. This radical shift is the heart of Cuba's medical story. We'll explore how Cuba built a system focused on prevention, trained doctors, and sent them worldwide. This is a messy, human story about a small island that dared to care for everyone. Pre-revolution Cuba was a land of stark inequality. Havana's elite enjoyed modern hospitals and private clinics, while rural Cubans had almost no access to care. Most doctors stayed in the capital, leaving the countryside neglected. For the poor, a doctor's visit was a rare event. Disease and malnutrition were rampant. Healthcare was a business, not a right, and the government had no plan to fix it. The rural poor simply weren't profitable, so they were ignored. Your health depended on your birthplace and your wallet. This deep divide was the wound the revolution aimed to heal. The stage was set for radical change. Healthcare inequality fueled anger against Batista's regime. For many, the lack of doctors was the most visible sign of government neglect. The revolutionaries made health a rallying cry, providing care to peasants even while fighting in the mountains. Rebel doctors became local heroes, proving a different Cuba was possible. Their grassroots work inspired the post-revolution health system, prioritize rural areas, focus on prevention, and serve, not profit. The old system's failures created a desperate, angry population ready for change. The revolution was driven by real struggles. Ordinary Cubans denied the right to be healthy. A dramatic transformation was about to begin. When Castro's rebels took power in 1959, healthcare became their top priority. They declared health a universal right, free and accessible to all. The plan dismantled the old, unequal system and built a unified national health service. But half of Cuba's doctors fled, fearing communism and the end of private practice. With only about 3,000 doctors left, the new system was on the brink of collapse. Most predicted failure, but the government doubled down. They saw the crisis as a reason to innovate, not give up. The doctor shortage became the catalyst for bold new ideas. Cuba would have to build a healthcare system from scratch. And they did. With half their doctors gone, Cuba started over. The new system focused on prevention, not just treatment. Massive campaigns for vaccination, sanitation, and health education swept the country. Volunteers, often students, went door to door teaching hygiene and vaccinating millions. Cuba eradicated polio while richer countries still struggled. They built neighborhood clinics, policlinicos, making care local and accessible. Each clinic served thousands, offering everything from emergency care to prenatal checkups. The family doctor and community clinic became the system's backbone. This decentralized, prevention-first approach kept people healthy and costs low. Out of necessity, Cuba created a healthcare model that would astonish the world. Cuba faced a doctor shortage after the revolution. Their solution? Train a new generation. Fast. Medical education became free, open to all, and focused on primary care and community health. Students learned hands-on, serving real communities from year one. By the 1980s, Cuba had one of the world's highest doctor-to-patient ratios, an army of white coats, ready to serve. Cuba had a bold plan: building clinics, training doctors, and wiping out diseases. It was working. But then, the US imposed a sweeping embargo, cutting Cuba off from vital medical supplies. Suddenly, doctors faced shortages of everything from insulin to surgical gloves. Yet instead of giving up, Cubans adapted, turning hardship into innovation and resilience. Just when it seemed things couldn't get any worse, they did. In 1991, the Soviet Union collapsed. Poof, gone. For 3 decades, the USSR had been Cuba's main economic lifeline, its big brother providing billions in subsidies, oil, food, and, crucially, medical supplies. This relationship had allowed Cuba's health system to weather the worst of the US embargo. But overnight, that support vanished. The Cuban economy went into a freefall. This catastrophic crisis was euphemistically called the special period in a time of peace. It was anything but peaceful. It was a fight for national survival, and the healthcare system was on the front lines. The impact was immediate and brutal. The country lost over 80% of its imports. There were severe shortages of everything: food, fuel, soap, and of course, medicine. Power outages became a daily occurrence, sometimes lasting 12 to 16 hours. Without fuel, ambulances couldn't run. Without electricity, refrigerated vaccines spoiled. The average Cuban lost about 20 pounds. It was a humanitarian crisis of staggering proportions. The gains in public health that Cuba had fought so hard for over 30 years were suddenly at risk of being completely wiped out. The question was no longer how to improve the system, but how to stop it from collapsing entirely. This was the ultimate test of the Cuban model. The system built on prevention and community care was pushed to its absolute limit. With hospitals struggling to function, the family doctors in the neighborhood became more critical than ever. They were the first and last line of defense. They kept meticulous records of their patients, identifying those most at risk from the food shortages and directing what little resources were available to them. They promoted urban gardens to combat malnutrition and organized community hygiene efforts to prevent outbreaks of disease that thrive in times of scarcity. It was a grassroots effort to hold the line against disaster. Incredibly, despite the famine-like conditions, the system did not collapse. While some health indicators worsened, there were no mass epidemics of infectious diseases. Infant mortality, the crown jewel of their system, rose slightly but remained remarkably low, a testament to the resilience of the primary care network. The special period was a national trauma, a period of immense suffering, but it was also a crucible. It forced Cuba to become radically self-sufficient. If the world was not going to sell them medicine, they decided they would have to invent their own. This dire necessity would give birth to a whole new industry. Faced with a near-total blockade on pharmaceuticals, Cuba made a pivotal decision. It would invest heavily in its own biotechnology sector. This sounds completely insane. Biotechnology is a high-tech, incredibly expensive field, dominated by giant multinational corporations in the world's richest countries. How could a small, cash-strapped island possibly compete? But for Cuba, it wasn't about competition. It was about survival. In the 1980s, even before the special period, Fidel Castro had seen the potential and had personally championed the creation of a biotech hub in Havana. When the Soviet Union collapsed, this bet on science became their only hope. So, while the rest of the economy was crumbling, Cuba poured what little money it had into its scientific research centers. The goal was to reverse engineer existing drugs and, more ambitiously, to develop entirely new ones. They focused on creating vaccines and treatments for the diseases that most affected their own population. It was a massive gamble. They trained thousands of scientists, creating a scientific pole west of Havana. The state funded the entire process, from basic research to clinical trials to production, creating a closed-loop system that was immune to outside market pressures. It was science driven by public health needs, not by profit margins. The results were, frankly, stunning. Cuban scientists developed the world's first and only vaccine against meningitis B, a disease that had hit the country hard. They developed treatments for diabetic foot ulcers that dramatically reduced the need for amputations. They created therapeutic vaccines for lung cancer and other innovative treatments that were years ahead of their time. They produced their own interferons to fight viral diseases and their own recombinant proteins for heart attacks. All of this was done under an embargo, using homegrown talent and ingenuity. The island that couldn't import aspirin was now creating sophisticated biologic drugs. This wasn't just about replacing what they couldn't buy. It was about creating a new pillar for their economy and a new tool for their foreign policy. The biotech sector became a source of national pride and, eventually, a source of export revenue. Cuba began selling its unique vaccines and medicines to other developing countries, often at a fraction of the price charged by Western pharmaceutical giants. The isolation that was meant to crush Cuba had inadvertently transformed it into a biopharmaceutical powerhouse. It was the ultimate act of defiance, turning a weapon of economic warfare into a wellspring of scientific innovation. Cuba survived the embargo and built a biotech industry from scratch. But its greatest export? Doctors. With more doctors than it needed, Cuba sent them abroad, launching a global medical mission. Cuban doctors became a familiar sight in dozens of countries, working in places others wouldn't go. This white coat army became the face of the revolution, a symbol of solidarity and hope worldwide. Cuba's medical missions weren't just humanitarian, they were a political and economic strategy. For some countries, services were free, supporting allies. For others, like oil-rich nations, it became Cuba's biggest export: doctors, not cigars or sugar. During the Ebola crisis, Cuba sent over 250 doctors to West Africa, earning global praise, even from the US. The world took notice. Cuban doctors save lives worldwide, earning money for Cuba and winning friends. But it's not that simple. The US calls the program forced labor, claiming doctors are exploited and the government takes most of their wages. Yet many doctors see it as a chance for growth, to support their families and serve with pride. The missions inspire both admiration and controversy, truly a Cuban paradox. Imagine a doctor who knows your name because they live on your block. In Cuba, this is reality, thanks to the Family Doctor and Nurse program. Doctors like Dr. Perez work from small clinics in their own neighborhoods, caring for about 150 families. He's not just a doctor, but a neighbor, trusted, familiar, and always nearby. House calls and prevention are routine, catching illness early and building real community health. Despite shortages, Dr. Perez remains proud, guardian of his community's health. Elena, a retired teacher in Cienfuegos, remembers when her family couldn't afford a doctor. The revolution's promise of free healthcare felt like a miracle. But now, waiting months for cataract surgery, she faces the harsh reality of shortages and delays. In Cuba, healthcare is free and protects families from financial ruin. Yet endless waits and missing medicines are part of daily life. For Elena, the system is both a savior and a source of constant anxiety. Dr. Caridad Valdez, a pediatrician from Santiago de Cuba, left her children behind for a 2-year medical mission in rural Bolivia. She faced isolation, power outages, and heartbreaking losses, but also moments of deep connection and purpose. Grateful families brought her gifts, and she found pride in helping malnourished children recover. Returning home, she rebuilt her house and gained a renewed sense of pride in her profession and country. How did Cuba, a small island under embargo, become a medical powerhouse? It's a story of revolutionary ideals clashing with harsh realities. Cuba chose to make health a human right, not a product. Crisis after crisis, they doubled down on their core principles. Today, Cuba is known for its doctors serving worldwide. Cuba dared to build a different kind of healthcare system and offered the world a powerful lesson. What can the world learn from Cuba's healthcare system? Cuba proves that health isn't just about wealth. Priorities matter more. Prevention-focused care and community doctors keep people healthy before crises start. And by putting people over profit, Cuba innovates for public good. The world can't ignore these lessons in caring for one another.